Thanks, Program Director. Ladies and gentlemen, comrades and friends, receive my warm revolutionary greetings this morning. As the Program Director has said, I am Anele Yawa. I am coming from South Africa. I am the Secretary General of Treatment Action Campaign. Treatment Action Campaign is a social movement whose membership are people living with HIV and AIDS, women, as well as the public health care users. I think before I can move forward, I need to raise my concern in this conference as to say, if we want to address the inequalities that exist globally, we need to start that here. It can't be true that we are talking about addressing inequalities, yet inequalities exist and are practiced in conferences like this. Like, for instance, myself and my colleague, we've got only 10 minutes to share because we are coming from poor communities. Yet, the previous speakers were given a lot of time. How are we going to address inequalities? I think that's where we need to start, as to say, if we want the world to change, we must preach what we practice. I therefore call upon the organizers of conferences like this not to treat people like myself and my sister as second-class or third-class citizens. We demand equality everywhere. I am coming from a country that was colonized as early as 1652. And as black people in South Africa, we were colonized. Our land was taken. And after we have been colonized, the colonialists introduced an evil policy or a law which is called apartheid. Apartheid divided people firstly based on their skin pigmentation, where black people were treated as third-class citizens and white people were the most privileged. That on its own contributed in the underdevelopment of the majority of the black people. I am not here to tell you about the fall of apartheid in South Africa or how good Mandela was or bad. But I am here to tell you that the majority of the poor people globally, they need a space. For quite a long time, the majority of the poor people have been left behind. For quite a long time, the majority of the people were excluded from the table. In many instances, they were given and are still given leftovers. We don't want leftovers. We want a full meal like any other person. And if we want to change the world, we need to start there. I am coming from a country where we've got good policies. But the problem, these good policies only exist on paper. In terms of the implementation, there is no political will, there is no political commitment from those who hold positions of power. The majority of the people in South Africa and elsewhere in the world are sick and dying. Many people are dying of HIV and AIDS. Many people are dying of malaria. Many people are dying of tuberculosis and other illnesses. And we must ask ourselves, who are those people? Those people are the ones who cannot afford. And we must ask ourselves why they cannot afford. It is because of inequalities and social injustices that deprived the majority of the people. The problem we have in the world, we've got all these institutions. You name them all. World Trade Organization, World Health Organization, you name them all. And the question that we are not yet ready to address, why in this institution always the majority of the poor people are not given full right to participate? I once went to the World Health Assembly in Geneva. I was shocked to watch it from the distance whilst I was there. Why? So it shows that our leaders and our governments, as long as they treat its own citizens as third-class citizens, we need to know that we are far from addressing the problems that exist. So before I can waste your time, I think there are a few things that we need to address as people of the world. We've got all these ambitious programs: universal health coverage, sustainable development goals, 1999. Who is going to implement these programs if our own governments are not willing to come to the party and be able to be accountable to the people who voted them into power? From where I come from, I'm coming from a country that is corrupt. Its leaders are corrupt. I'm coming from a country where the state president spent about 250 million rands to build his own house. Yet the majority of the people are still living in poverty. I am coming from a country where if you want business, you need to be connected to certain leaders within government. Corruption is rife, and in my country, now as far as I can see, corruption is being legalized. World Trade Organization, early 2000, took a decision around TRIPS flexibilities in order for the majority of the people who are poor and dying can be able to access affordable, effective, and quality medicines. Why our countries are not yet ready to implement those TRIPS flexibilities so that the majority of the poor people can be able to access these medicines. We need to ask ourselves why our governments and leaders takes decisions, come up with policies around service delivery. They build institutions and infrastructure. But our own governments, they don't go and access these services that they have built for their own people. If you go to Africa today, none of the leaders themselves or their families, when they are sick and dying, they don't access healthcare services in their own countries. They go to Europe. Whom are they building these services for? If you go to Africa, none of the ministers or political leaders, their children, they are not accessing education in Africa. They are going to Europe because in Europe there is better education. So we must ask ourselves, where are our leaders leading us to? Lastly, in my country, the Minister of Health has introduced national health insurance, which seeks to bridge the gap between the rich and the poor. But simply because of private healthcare sector, and some pharmaceutical companies, they are not happy about that because it is not going to make money for them or profit. So they are trying by all means to stall that program so that that program cannot go forward. So we need to ask ourselves whether these policies and programs that we're talking about, it is just a rhetoric or we want to address the problems that we are faced with as people of the world. I thank you.